I was thinking someone brought that up. We were talking Kendall, Sarah and Kendall again, and she like we were should we go to this and shaking out and I don't want to walk and I was like, not doing anything anyway. Yeah, so we were just
Oh, no worries. Did you send an email? I did. Yeah, so you can take it out to the lockers.
Oh, locker. She was asking about the locker.
Thank you.
Something got brought up and it was like, oh shit, we were all like, oh, we still don't have lockers. Like, I know. And Derek goes, oh, they're big. They're not enough. They're tiny. In the bottom. Yeah, they're big. Like, oh God. Yeah. Yeah. Yeah, like you have, there's one of the two. Like you have to. Mandibular, like a box to box. That's what I thought too. And one of them is also working I don't know. I just said that one. What is she like? She's like, is she a brown hair? No. She's a Kendall. She was kind of taller. She's a center back. She's a center back. I know. Because I know who you're talking about. It's not her. They're all blonde except for like two. So they all kind of look the same. They do. There's this lady. She's nice. She's like. She's like a. But she was really nice. She's a midfielder. She was a little. She's short. You're not no all on sort of. I'm like, anytime I hang out with I always hang out with all three of them, and I'm like, guys, yeah. I get fired out. That's so what does he want?
let's go ahead and get started. How's everyone doing this morning? Not bad? You guys gonna try to see the eclipse later? What time is it gonna be around here?
3:15.
Okay. Yeah, same for me in the Toledo area. Okay, cool. So today we're gonna continue with food microbiology. Oh, and as for your exams, I will be passing those back on Wednesday. Sorry, I have one more student that needs to take it. And so the average was a 78%, which is just perfect. So there won't be a curve on this one, but at the end of the semester, before finals, we'll see, if it's an option for me to see if you guys can drop an exam or not. But regardless, you guys are all still doing really well in the class, especially because the lab is graded for participation. Each lab is 25 points, so that really has helped your grades. It's about half of your, grade in the class altogether. And then you have the worksheets, which are 10 points each, so that should also add to your grade. So, all right, so let's continue on with food microbiology. It's chapter 16 in the textbook once again, and we stopped over here where we were talking about sterilization and how that kills like absolutely everything in all microorganisms. Anything that's living will be dead when you sterilize something. So does boiling a liquid sterilize it? So that really depends on what was in the liquid to start with. There are certain bacteria that can make endospores, and we've seen before that endospores are resistant to heat. Not all types of bacteria will form endospores, but those that do, they won't be, killed off just by boiling. And so just a reminder, some bacteria that form endospores are common among soil bacteria. This also depends on how long you also boil the liquid. So heat-induced microbial death isn't instantaneous. It's also a function of time, as well as the temperature and the microbial species. So there are different things that will affect it. And so one of the major factors that controls microbial growth is temperature. And so temperature, is really important, depending on the species. So over here on this graph, can you all hear me okay in the back? All right. So this is the growth rate of certain, different types of bacteria. It's not specific, and this is temperature going from colder to warmer. And so at very, minimal temperatures, this really slows down the processes of growth, including transport processes. So not a lot of things can grow at really low temperatures. There are exceptions to every rule. And so as you kind of go up in temperature, things get warmer, then enzymatic reactions can occur at increasingly rapid rates. And then once you hit, a really high temperature, this is called an optimum temperature. So enzymatic reactions can occur at the maximum possible rate. That would be the optimum. And then the very maximum temperature, sometimes, some bacteria are able to withstand really, really, really high temperatures, and we'll talk about those, but, at really maximum temperatures, then that will denature or degrade the protein synthesis, and so you'll, eventually just kill the cells by having really, really high temperatures. So the minimum, the optimum, and the maximum temperatures at which a microorganism can grow, these are called cardinal temperatures. So that encompasses all three. And so different microbial species, and even sometimes different strains of species, can have different cardinal temperatures. So each microbe has a minimum, an optimum, and a maximum. A minimum where it can't grow, an optimum where it can grow at the best possible rate, and then a maximum where it's gonna be dead, it's gonna get killed. And so kind of going off of this, microorganisms can be classified into groups or categories according to their growth temperature optimum. So usually that's how we characterize different types of organisms based on the optimal growth temperatures they can grow in. And so a psychrophile is a microbe that can grow optimally, so it has the maximum growth rate at really low temperatures, so they can grow in really cold temperatures. So these are called psychrophiles, and I'll have definitions on a later slide. And then a mesophile is basically something that can grow in a more moderate temperature, still cold, about 40 degrees Celsius. A thermophile, hence the name therm, so that's something that's going to be hot, so that's going to be a higher temperature. A thermophile can grow at about 60 degrees Celsius, so even higher temperatures. And you have a hyperthermophile, and so there's two classes of them. There are some that are even more hyperthermophiles, and so those can grow at really, really, really high temperatures. So that just kind of shows, the key here is that the way that we classify these organisms and give them this name is based on their optimal temperature at which they can grow. Any questions on these at all? All right, so temperature classes of microorganisms. So this is just some more definitions. So a mesophile, they're not in the same order as what was shown on the previous graph, but a mesophile or mesophilic organism is a microorganism that has a mid-range temperature optimum. It's found in warm-blooded animals, terrestrial and aquatic environments, temperate and tropical latitudes. So basically the point here is that there's a very big range of places that you can find mesophilic organisms, and that's because they kind of are in the middle in terms of what they can survive. So they're going to be found in more types of environments. And then thermophilic and hyperthermophilic are those that have a very high temperature optimum. Psychrophilic are those that have a cold temperature optimum. So they permanently inhabit really cold environments, and usually the maximum temperature is about 20 degrees Celsius. There are, within the psychrophilic organisms, there are psychrotolerant organisms, or psychotrophic is another way that they're called. And these are basically psychrophilic organisms that can, grow at about 0 degrees to -20, just like these. But they can also kind of still grow at like 40 degrees Celsius, so you can still kind of increase the temperature. They can tolerate a little bit more, whereas these psychrophilic organisms are, more are not going to grow as well in 40 degrees Celsius, and they kind of max out at about -20. And so, yeah, these are more widely distributed in nature than psychrophilic microorganisms, because obviously in nature you have higher temperatures than the very, very cold temperatures that psychrophiles can survive at. And because of that, because these are able to tolerate temperatures that are a little bit warmer, these are organisms, psychrotolerant organisms, are responsible for cold storage, spoilage of foods. So when foods spoil in like a refrigerator, these are usually psychrotolerant organisms. Questions on this? Okay. So food spoilage, what does that mean? It's basically any undesirable physical change in the food. And so generally it doesn't necessarily mean it's going to be harmful, but spoiled food is considered unsafe because high numbers of spoilage organisms indicate that the conditions have favored microbial growth, and those microbes can then include potential foodborne pathogens. So for instance, if you have like a spoiled cheese, or if you have like cheese in your fridge and you realize that a small part of it has some mold on it, do you guys normally cut that part of the slice off and then just leave the rest of it and eat the rest of it, or do you guys just toss the whole thing away? And there's no correct answer. It depends on the food. Yeah. Do you guys have any? Yeah, it really depends on the food, but yeah, so a lot of times, you can just kind of cut off the edge that's spoiled and then just eat the rest of it. But yeah, so that's why spoiled food isn't generally like harmful, but you do want to be safe than sorry. And so I don't know, I throw everything away just to be safe. But yeah, if you see something spoiled, this could include a potential pathogen. And so there are different organisms that will spoil foods, from bacteria to fungi, and so we'll talk a little bit about what classes of organisms these are in. So there's a range of bacteria that are important in food spoilage, and like I said, psychrotolerant organisms can multiply in the fridge. There are Pseudomonas species that are responsible specifically for milk spoilage and blue growth on the cheese. So that's coming from a Pseudomonas species. And then within the bacteria, there are also organisms that form endospores, like we said. There are some bacteria that can form endospores and then can survive cooking, and in some cases, canning processes. Prevalent spore formers are Clostridium species and Bacillus species. So we in lab did a spore stain with that malachite green, if you guys remember. That organism was Bacillus megaterium, that B megaterium that we've been using in the lab. So that's one of those to remember. And so, like I said, boiling doesn't necessarily sterilize things, and so even really high temperatures and cooking, that's not gonna, kill endospore forming organisms. So within the bacteria, the ones that are important in food spoilage are psychrotolerant organisms and endospore forming organisms. And then obviously there's fungi that can spoil foods, and so it's important to know that fungi grow readily in acidic environments because, like we talked about last week, bacteria have trouble surviving acidic environments. And again, if you think of the stomach is very acidic, and so a lot of bacteria don't survive there, so there's a lot less bacteria in the stomach than there is in the intestinal tract below it. And so that's why fungi are able to grow readily in acidic environments, and then also low moisture environments. We also talked about bacteria really liking moisture and water content, and so that is, if you see a spoiled food and it's a low moisture or a low pH, then it's probably a fungus that's growing. Grain and peanut storage spoilage. So peanuts, they're very, very dry, but they can be, and grains can be basically spoiled or can have fungi spoil them. So food spoilage, can lead to foodborne illnesses or illnesses that are derived from foods. And this is commonly referred to as food poisoning. And so this results from a failure of properly using, your preservation methods or preparing your cooking techniques to avoid the growth of microbial pathogens. There's an estimated millions of cases of food poisoning that occurs each year. And among the food poisoning or foodborne illnesses, there are two different types. There's intoxication and there's infection. And so intoxication is, there's an important distinction here. So an intoxication is a disease that results from ingesting food that contain a preformed toxin that the microbe produces. And the microorganism, or the organism that produces the toxin, doesn't necessarily have to infect the host, but it has to produce that toxin, and that toxin will affect the host. The time of onset is typically 4 to 12 hours because they're actively producing a toxin, so it's going to be a quicker onset. And then with infection, this is a microbial infection results from ingesting the pathogen-contaminated food, and that has to include the growth of the pathogen in the host. So in intoxication, you don't necessarily have to have the pathogen growing in the host, but in infection, you have to be infected by it, and they're not producing a toxin, so it's actually the pathogen that's causing the infection. And because it requires the pathogen itself to be, present within the host to cause an infection, it usually takes about a day or two to have your onset of symptoms. Does that make sense? So there's a lot of different factors that determine somebody's risk for developing a foodborne illness. Obviously, the type of microbe or the toxin that's ingested. Inoculum size is really important. That's how many microbes you ingest or the amount of toxin that you ingest. The more you have in your body, the worse and more likely you're going to actually have the illness or food poisoning. If you don't have enough stomach acidity for some reason, organisms have to be able to survive the gastric acids in the stomach in order to reach the small intestine and also the large intestine and cause disease. So if you have inadequate stomach acidity, then they are able to survive those acids in the stomach and cause disease. And then if you have, obviously a reduction or change in your normal microbiota in the host, so if you're using antibiotics, that's going to, basically decrease or diminish the colonization resistance by, the commensal organisms. And so, antibiotics do that. And so that way, certain microbes can kind of, take over that niche that's been depleted by antibiotics. Susceptible populations obviously include very young individuals, very old people, and hospitalized or immunocompromised patients. And so sometimes you can tell that food has excessive microbial growth in it, and sometimes you can't. So it's not always going to be visible. Sometimes it's going to be, a physical change. Sometimes it's going to be a gross smell. Sometimes you can't tell at all. And so we're going to kind of now go through some examples of both food intoxication, different types of intoxication you can get from food and the different organisms that cause it, and then also different types of infections. So food intoxication is an illness that results from consuming a toxin produced by organisms growing in a food product. And so when the food is ingested, it's the toxin that's responsible for the illness, not the organism. So we're kind of reiterating things here. And we're going to talk about these three types of bacteria that are common causes of foodborne intoxication. So Staphylococcus aureus, E. coli, and Clostridium botulinum. So first, we'll talk about some heat-stable enterotoxins. And so it's important to know these organisms, and I will always have a little note on the top that will, remind you if it's an intoxication or an infection. So Staphylococcus aureus basically produces this heat-stable enterotoxin. And when you see entero before anything, it means that it's relating to the intestinal tract. So it's a toxin that you ingest. It's able to pass through the stomach. It's not killed by the stomach's acidic environment, and then it gets into the small and large intestine. So heat-stable enterotoxins are produced by Staphylococcus aureus, as well as some strains of E. coli. We'll talk about that later. And basically, heat-stable, so they're stable even upon heating at 100 degrees Celsius for 30 minutes. They can withstand a lot of heat. And so usually they are protected. These organisms are protected from just kind of like lysing by enzymes in the small intestine. So that's the duodenum and the jejunum. Those are two parts of the small intestine. The third is the ileum. And so basically when you have this type of infection, a heat-stable enterotoxin, that elicits a net secretion of ions and water in your body, and that will result in really, bad watery diarrhea and abdominal cramping. And so the rapid onset of diarrhea is going to be less than 12 hours. Remember, if it's a toxin, it's going to, you're going to have symptoms right away within 4 hours usually. There's no fever or blood in the stool. Fever is usually associated with an active infection in your body. And so, that's not going to occur when you have a toxin, at least for most individuals. But so heat-stable enterotoxins are, a really important source of intoxication. And so if you get Staphylococcus aureus food poisoning, the source of it is usually the human carrier. So we've been using Staph aureus in the lab. So we have a non-pathogenic strain of it. And so usually it's a common skin and nasal microbe. So it's a commensal organism. You can find it on your skin and in your nasal cavity in humans. And when you're preparing your food, it's usually the person making the food that will inoculate it into the food during preparation. And so if the food is left at room temperature, then that will allow the Staphylococcus aureus to grow and then produce that toxin. So it's heat stable and it's not inactivated by cooking, like I said. Any questions on this? Kind of switching gears a little bit, canning, where we'll talk about briefly, is an extremely effective method to preserve food. And so the principles of canning include processing, heat processing at high temperatures for a fixed period of time, which will destroy the majority of microbes. That will inactivate endogenous spoilage enzymes. So those are enzymes that have an internal cause or origin in order to cause spoilage. And so that usually will inactivate it. The oxygen is driven out, so a vacuum is used to suck out all of the oxygen. And so, lower oxygen, microbes like oxygen environments. So if you reduce microbial oxygen, then you're going to reduce the microbial spoilage chemistry. And then once you close it and you cap it, a vacuum is formed upon cooling that prevents recontamination. And so the canning process is designed to basically destroy endospores, so bacteria that can cause spores. So improper canning can actually promote the germination of endospores. And this can occur when the temperature of the process is not high enough or held long enough. And then errors are extremely rare in commercial canning nowadays. We've kind of really optimized the canning process. Improper home canned foods can be a concern. And so Clostridium botulinum, can anybody guess what botulinum, this toxin that is produced by Clostridium botulinum, has been used in a cosmetic and reconstructive setting? Botox, yeah. So basically, botulism is a paralytic disease that's caused by the ingestion of a neurotoxin from Clostridium botulinum. Neuro, obviously, a neurotoxin will alter the structure or function of the nervous system or your nerve tissue. And so that doesn't necessarily mean the brain, it could be anywhere. And so, like I said, it's produced by this spore-forming anaerobic rod called Clostridium botulinum. And so, the growth of an organism or production of a toxin may not result in changes of taste or appearance of food, but this toxin, because it paralyzes and it's able to infect your nerves, a lot of people use it in cosmetic settings for, with Botox. That's how we made Botox. We basically used this toxin that's produced from Clostridium botulinum, and it's used to, basically paralyze the nerves when people use it cosmetically, and because your nerves are paralyzed, they can't move, and that's why your face doesn't move as much. Another example of that is a lot of people that have TMJ or like a jaw disorder. For instance, I at one point actually had my jaw was like clicking, and it was just like really, really, really painful. And so my insurance covered for me to get Botox, where they basically paralyzed my jawbone so that it wasn't like locking and clicking as much. So you can do injections in your actual like nerves. There's like a certain nerve in here that like they can paralyze, and so that helped like fix my jaw while I was doing Invisalign, because it was like shifting and it was just really, really, really painful. Some people use Botox for headaches. So there's a lot of other uses for it other than in the cosmetic setting, but this is where we, derive Botox from. So you can always, take advantage of some of these things that microbes produce in order to implement them in human health settings. So botulism, the disease characteristics, if you have the actual botulism, intoxication, in adults, symptoms generally hit 12 to 24 hours after ingestion. That's going to cause nausea, vomiting, visual impairment, loss of mouth and throat function because of that paralytic effect, fatigue and loss of coordination, respiratory impairment, trouble breathing, also because of that paralysis that it can cause. And then abdominal pain. It can either be diarrhea or constipation. So it's not an enterotoxin. It's not something that's going to affect your gut, and then an enterotoxin will lead usually to diarrhea and a really high net ion of loss of water and ions. So in this case, you can either get diarrhea or constipation because it's a neurotoxin. In infants, this can cause constipation, days to a week after onset, generalized weakness and a weak cry, poor feeding and sucking reflex, lack of facial expression, floppiness, loss of control of their movements, and respiratory arrest can occur through death as well, but death is rare. So the spores, the C. botulinum spores are found widely in soil, dust, and honey. And so adults and children older than 12 months who swallow the spores are almost never affected, but when infants swallow the spores, they can germinate in their very immature GI tracts and then produce the toxin. And so that's why it's known to never give honey to an infant. It's because honey can carry this toxin, and if you're over a year old, and this goes for a lot of other foods that you can't give to infants, we can handle it when you're a little bit older, but when your GI tract is very immature, it can, really hurt an infant. Any questions on that? So the next intoxication, food intoxication organism that we'll talk about is Bacillus cereus. So it's a gram-positive spore-forming rod, so it also forms spores. And it's a facultative anaerobe, which means that it usually, it will basically use up whatever, it doesn't like oxygen, but it can still grow in low levels of oxygen. And so this one is widely disseminated in nature. It's found in soil. It can be present in the feces of healthy individuals. And this one is known to cause a diarrheal disease called fried rice syndrome. And so it basically will produce, we know that it produces at least 3 enterotoxins. And so this is, obviously, because it's an enterotoxin, at least 3 of them, then you're going to have diarrheal disease. So it's because it's usually found in grains, especially rice. That's why it's called fried rice syndrome. And the incubation period is usually 8 to 16 hours, and it lasts for 1 to several days. So these are the 3 bacterial agents that we talked about that are associated with food intoxication. So just a little summary table. Staph aureus and Bacillus cereus are enterotoxins that are heat stable. But the Clostridium botulinum is a neurotoxin, so that's something you should know the difference of. And so also the source of contamination, what the type of toxin is, and implicated foods that it can be in. All right. Any questions before we move on to foodborne infection? Okay. So, like I said previously, foodborne infection requires consumption of the living organism, the microorganism pathogen. And so usually that will require invasion of the large intestine mucosal surface by the infection. So it has to go through, survive the acidity of the stomach, and then it goes through the small intestine, and then in the large intestine, the colon. And so symptoms don't usually appear for at least 1 day after ingesting it. And basically that's because, the actual organism has to get into your body, not just the toxin. The major symptom in foodborne infections is typically diarrhea, but others can really, lead to certain damage or infection or inflammation, or even like rupturing of the large intestine epithelium or the colon epithelium. And when that happens, that can include seeing blood in your feces, fecal leukocytes. Leukocytes are basically a lot of white blood cells that are in your feces, and that indicates that there is some sort of infection going on, and your innate immune system is trying to fight that infection off, and so that's why you'll see a higher count of leukocytes. Fever and body aches are also ways that your immune system is trying to fight off an infection. So that's a response of your immune system. And normally, in order to kill and prevent foodborne infection, we thoroughly cook food. And so that will, usually kill most of the microbes that are responsible for infection. And the main foodborne illnesses that are commonly caused by Salmonella species, Campylobacter species, and E. coli diarrheagenic strains. So these 3. So flour is a raw food, and E. coli and Salmonella species can contaminate grains while it's still in the fields, or the flour when it's being made. So steps like grinding the grain and bleaching the flour doesn't necessarily kill E. coli and Salmonella, and they can end up in the flour or your baking mixes that you buy at the store. So don't taste or eat any raw dough or batter. That's my advice to you. Don't let children play with or eat raw dough, including dough for crafts, if that wasn't already intuitive. Bake raw dough, such as cookie dough and batter, before eating it. I know I've tasted it because it's just so, it's really, it tastes good, and it's nice to just taste it before you cook it. But yeah, don't eat your raw dough. Follow the recipe or package directions for cooking or baking, and use the temperature and cooking time given in the recipes. And don't make milkshakes with products that contain raw flour, such as cake mix. Don't use raw homemade cookie dough and ice cream. And so cookie dough ice cream sold in stores contains dough that has been treated to kill harmful germs, so you can eat that. So flour is a raw food, and that can contain these two types of organisms that can lead to a foodborne infection. And so these two are commonly associated with poultry or chicken products. And usually inadequate cooking can result in foodborne infections. I'm sure you all know to cook your chicken very thoroughly, because that can, result in Salmonella or Campylobacter infections. And so adequate cooking usually will prevent the infection and kill the bacteria. But one of the main ways that you get, you get an infection with, something like this, even if you end up cooking this chicken really, really well, a lot of times you have cross-contamination. So if you use the same knife or the same cutting board for your veggies, as the chicken before you cook the chicken, then you can cross-contaminate, and the organisms, the Salmonella or Campylobacter, can then end up on your knife that you use to cut your veggies, and you can still get infected. So thoroughly cooking is definitely a way to kill the bacteria in the food source, but you have to always think of cross-contamination. I always use 2 different cutting boards when I'm making my salad, and then also like cooking chicken, different knives, and washing it simply with water, is not gonna, suffice. If you prepare your chicken and then put it in a pan and quickly rinse off the cutting board and put your veggies on there, that's not gonna work. You wanna use soap, and really make sure you wash it well if you're gonna use the same cutting board. So salmonellosis is the causative agent is Salmonella species. It's a motile organism, so it can move. It's gram-negative, and it's an enterobacteria, so it reaches your small intestine or your large intestine, and that can result in a lot of diarrhea. Symptoms are gastroenteritis, so basically inflammation in your gastric system and food poisoning. And then you'll have nausea, vomiting, abdominal pain. You can have fever and diarrhea, and this will usually occur 24 to 48 hours after ingestion. If you have an infection like a salmonellosis infection, usually that's self-limiting. So what that means is it can resolve without treatment with antibiotics. You just kind of have to let it out of your system through these ways of your body's way of getting it out is through vomiting, nausea, diarrhea, and the fever and pain are your body's way of telling you that something is wrong. Your immune system is trying to fight it. Symptoms are generally short-lived. They can range from mild to moderate, and that really depends on how virulent the strain is and the number of infecting organisms. So if you have more inoculum size, then that's obviously going to make it worse. It's going to take longer to clear out of your system. So Campylobacter jejuni is the most common cause of bacterial diarrhea in the world. And this obviously is, due to inadequate cooking, and usually it's poultry, untreated water, unpasteurized milk, and exposure to animals with diarrhea. You can get it from other animals. It's also self-limiting, so it will resolve on its own over time, and antibiotics aren't usually needed. But it can cause a high fever, headache, malaise, which just means general discomfort, And the exact cause of it is difficult to identify, so it's general discomfort, nausea, abdominal cramps, bloody stools. For this one, there's a low infectious dose, so you don't need that much in order to get the disease symptoms or the infection symptoms. And one thing is that Campylobacter replicates in the small intestine. The small intestine comes before the large intestine. Any questions on these? So Campylobacter jejuni is a curved S-shaped gram-negative rod. It's motile, just like Salmonella species. So this one, can move. It has either a flagella on one or both ends, so it can move. It's a microaerophile, which means that it requires environments that contain lower levels of oxygen than what's present in the atmosphere for its optimal growth. And it grows best at 42 degrees Celsius, so that's 107.6 degrees Fahrenheit. So that's a really, really high temperature, and that's where this grows best. So this one's, a bad one to have. Any questions? Okay, and so E. coli, there's so many different strains of E. coli that, can be used to study. The ones that we have in the lab that we use all the time is a non-pathogenic strain. Most of the E. coli strains are non-pathogenic, but there are some that are foodborne pathogens. And so usually all pathogenic strains are an intestinal type of parasite, and a few can produce enterotoxins. So I'll say this now, and it'll be on the next slide. E. coli can cause intoxication or infection, depending on the strain. So it's one of those where it's really like there's so many strains of E. coli out there. So Shigatoxin, basically it's formerly called enterohemorrhagic E. coli, or EHEC, that produces a verotoxin. Basically what that means is that it gets really, into your intestinal tract and even in your kidneys, and it can cause bloody diarrhea and kidney failure. Other types of E. coli, there's other names for them. There's an enterotoxigenic, enteroaggravative E. coli, enteroinvasive or adherent invasive E. coli. I actually studied this one in undergrad. We called it AIEC. It was adherent invasive E. coli. There's uropathogenic, UPEC, and enteropathogenic or EPEC. You don't have to know all of these names, but just know that there are so many different types that can either aggregate or invade, that can be in the urinary tract or in the, that's the uropathogenic, or it can be in the entero tract, so that's basically the intestinal tract. So once again, E. coli can cause both intoxication or foodborne infection. It really depends on the strain of E. coli. And then beyond that, it also depends on the virulence mechanisms or the pathogenic mechanisms that are encoded within the genome of that strain. So if it encodes genes that cause it to be more virulence genes, then it can be more pathogenic. Questions? Yeah.
So like a specific strain cannot be both, cannot cause both intoxication or infection, it's
Yeah, that's correct.
Okay.
Yeah, a specific strain will basically, either cause one or the other, and so a strain is really like the lowest classification level you can have. You can have different species of E. coli. A species basically is, encompasses different strains. So there's different strains within the species. So you can have a species of E. coli that can cause one or the other because they're strain specific. Does that make sense? Good question. So E. coli, we know, causes bloody diarrhea. This specific infection, the O15787. And so sometimes that can develop into life-threatening hemolytic uremic syndrome. So that, is life-threatening and can cause death. And so the specific strain was responsible for several large food poisoning outbreaks that we've had. Ground meats are also a source of foodborne infection, obviously, that aren't cooked well. And so basically the surface area is expanded in ground meats and microbes are distributed, so the ground meat should be cooked thoroughly through. And then you can also have contaminated food and water as sources of this specific strain. So that's unpasteurized milk and juices. Cows can be carriers of it, but cows don't get the disease, which is interesting. And so the way that that happens is you can, use manure as fertilizer, and the runoff allows contamination of the vegetable food crops. So the next type of infection we'll talk about is Listeria monocytogenes. That's the bacteria name. And so this one tolerates really high salt concentrations and can survive really a large range of pHs. So, this is 4.4 is more acidic, and neutral is 7, and then 9.6 is obviously more basic. So it can tolerate high salt concentrations and different pH ranges. And so the primary foodborne sources of Listeria monocytogenes are, ready-to-eat deli meats, hot dogs, refrigerated pâtés or meat spreads, unpasteurized or raw milk and dairy products, soft cheese made with unpasteurized milk, like queso, feta, brie, camembert, and then refrigerated smoked seafood can also be a source of this Listeria monocytogenes. The disease associated with Listeria monocytogenes is called listeriosis. And so this can lead to bacteremia and meningitis. So bacteremia is basically bacteria in your bloodstream, and meningitis is when you have bacterial infection in the brain. And so this one is usually found in soil and water, and it's cycrotolerant, so it can grow in a refrigerator. It can grow at cold temperatures, especially in the refrigeration. And so normally it's killed by cooking and pasteurization. And then obviously it's a foodborne infection, so it's transmitted to people through food. So listeriosis, basically this infection can cause severe disease in different vulnerable groups. And then one thing that's important about this one, we know that now that it's an intracellular pathogen. So what that means is our immune system contains certain cells that will attack, this type of bacterial infection. And so this pathogen is taken up by phagocytes. So those are like macrophages, for instance. So a macrophage will engulf the bacteria. But this type of bacteria is able to take advantage of our macrophages in our immune system by growing and proliferating inside of the phagocyte. So it's an intracellular pathogen, so it can get into our immune cells and use it as a place to grow and replicate. And so because of that, the mortality rate of listeriosis is really high. And so it can cause death because, our immune system tries to attack it, and it can take advantage of that and use our immune system against us to grow and reproduce itself. It usually will cause non-invasive gastroenteritis, so, it doesn't necessarily invade, cause like bloody diarrhea and stuff, but it will, cause diarrhea, chills, vomiting, fever. And so if you have invasive disease, then that is when it can invade into the bloodstream and then reach, septicemia. That takes about 5 days to 3 weeks. So septicemia means that you're septic, which means you have a bacterial infection in your blood. And then you can get meningitis. So that is, like I said previously, an infection in the brain, so it can go across the blood-brain barrier when it's invasive. It can cause endocarditis, which is a heart infection, so basically can get into the cardiac tissue. Usually it's on a valve in your heart. And so this one is really, really dangerous because it can be non-invasive and just stay in your intestinal tract, or it can, invade and get into the bloodstream, and then it can cross the blood-brain barrier and cause meningitis. It can also infect your heart. And so, because of that, the way that it can get to the bloodstream and get into your organs is because it's, being transported in those phagocytes in your body. So your immune system's trying to kill it, but then it just replicates. It takes advantage of that, and it gets in your bloodstream, and it's able to be taken up into your organs. Higher risk groups obviously are more prone to getting the more invasive infections, so like pregnant women. This can cause, febrile illness and fetal loss. Newborn infants can get a bloodstream infection or meningitis, as well as people with immunocompromised conditions like bloodstream infections and meningitis. Older adults can also get bloodstream infection or meningitis. And so, yeah, there's different types of people. So people that are immunocompromised also can take certain vaccines. I'm not entirely sure if listeriosis, there's one for that, but there are certain vaccines that are given to people that are immunocompromised. For instance, people that are asplenic or don't have a spleen. The spleen usually filters infections from the blood. And so people that are asplenic will get, meningococcal vaccines. So for certain meningitis strains, in order to make sure that, they have that type of, just have a lower risk of dying from those infections. And so listeriosis is rare, but it's deadly. And so listeria, the number of illnesses is a lot lower, 1,600 only, but has, really high deaths. So the case fatality rate is 16%, whereas the others, Salmonella, Campylobacter, those are usually self-limiting, so they kind of resolve on their own once once your body clears it. There's a lot more, cases, and there's like about 1 million plus cases, and so the number of deaths ranges. It's a little bit lower compared to the total number of illnesses. And then Shiga toxin producing E. coli, this one also is 96,000, not as many deaths, and then case fatality rates 0.5%. So it's important to know that listeria is the one that's more rare but more deadly. So how do you tell if there has been an outbreak of a foodborne illness, and what do our public health officials usually do? So first, they'll be able to cluster cases by symptoms. They see that many people have these symptoms, especially, this happened in a lot of university environments when something goes around, especially, in the dining halls. There's people that will have a lot of symptoms, so they'll try to cluster the cases. They'll try to isolate what pathogen it is from each case, to be able to figure out, what it is that is causing this foodborne illness. And then, they'll try to identify the common food to all of the cases that had it. Then they'll try to isolate the pathogen from the suspected food, and then retrace the distribution of the suspected food, and then isolate the pathogen from the suspected food at a common distribution point. And so that's how you know exactly where it came from. You have to actually go back and isolate it from that point, like patient zero source. And that patient is the food, essentially. Because that's where it's coming from. So the CDC, has information about all of the selected, this is specific for E. coli food poisoning outbreaks and the investigations. So, I'm sure you guys have lived through this and probably remember, in 2011, I remember not being able to, eat romaine lettuce for a while. This has happened other times. I remember in 2017 when leafy greens, I remember we all had to throw out our salads and stuff that we had just bought because we were told that there was an E. coli outbreak. And so you can see that this O157H7 strain is really one of the biggest ones that is out there. And so this is just kind of an FYI of different things that can cause E. coli infection. And so you can see a lot of it has to do with greens and beef products and things like that. Yeah. So the CDC always has an updated outbreak list, so you're welcome to scan this QR code and like bookmark it or whatever and just have that as an FYI for you guys, so you can find current information about current and past outbreaks and any associated recalls, if you're so inclined. But you can see, you know, a lot of these different foods that we've talked about. There's raw cookie dough, salmonella recently, and things like that. So for you guys. And so kind of just ending, you know, with a good example that will encompass everything that we've talked about. You know, what would happen if you left the following foods out on the table overnight and then you ate them? So, you know, for instance, this right here, high or low moisture content? Low, yeah, so you'll probably be okay eating that. So obviously if you have something like jelly or jam, you know, this has more moisture, there's a lot of sugars in there. This is, I think, like mustard or something, so that's gonna have a lot of spices in it. Do you guys remember what I said about spices, like what they have? Yeah, they have antimicrobial like properties that they produce these bacteriocins that can are naturally occurring and can kill bacteria. And then over here, milk and the turkey and the soup and even this yogurt, you know, these have high moisture content. These are perfect cultures for microbial growth. But it's important to remember, you know, different microbes have different nutrient environments, so not all microbes will grow. The ones that are able to survive in that environment can grow, so because their nutrient environments are different. So that's all I have for you today. Any questions? All right. Have a good day. Have a good Monday. Hope you enjoy the eclipse.
I'm not going to funny.
We're gonna go to